is a high flow nasal cannula. This is an Airvo. It's an Airvo 2. There is an Airvo 3 out now, so you might see like a more updated version of this. This machine has a 50 psi oxygen connection. It has to be connected to oxygen, whether that's, well, it has to be the tank in this, the wall in this case. So it needs to be connected to the oxygen in the wall with the 50 psi connection. It is also electrically driven, so it needs to be plugged into electric. What kind of plug do we want all of our devices to be plugged into? A red plug. What's a red plug do?
Generate electricity.
It's attached to the backup generator. So if the power should be lost in the hospital, the backup generator should kick on within a certain number of seconds. That's a state requirement. And your equipment should not lose power, okay? Is this probably a pretty critical piece of equipment if a patient's on it?
I would think
We
so.
want it to keep running, right?
Mm-hmm.
Okay, so the Airvo is pretty simple to use. We are connected flow meter to machine, okay? There's only a few buttons. There is a giant power button with the binary 0 and 1. This is your power button. You're gonna hold that until you hear the beep. It has auditory alarms to let you know it's on. It beeps when you turn it off. It beeps when you make changes. So the screen will come up with, first it says Airvo. Now it's gonna talk about last disinfected. In between patients, if you use this machine, there is a red hose. You take the humidifier out. This is single use, right? Circuit is single use. Interface, our prongs are single use. So you dispose of those, clean the outside of the equipment per manufacturer's recommendation, and you're gonna use this red hose that is non-disposable that comes with the equipment. And you connect it from here to here, and you run a disinfection cycle. It lasts about 55 minutes, I think, with this machine, so it's out of commission for at least 55 minutes after you take it off of the patient and clean it. We have a silence button, so it's like the bell with the X through it, if you're trying to silence an alarm while you're setting it up. You can see on the main screen the temperature, the flow, and the FiO2 you have set. If you want to change one, you hit the play button, basically, it's the little triangle button. It'll highlight, and then you're gonna hold down the up and the down arrows until the number starts flashing, and then change it to what you want it to. Airvo only allows you for temperature to have 37, 34, or 31. What do you think we want on an adult patient? 37. So when I have the setting I want, I just hit the play button again. And then it will lock. The lock kind of blinks, and then it locks. So you can't change it again until you are on the one that you want and hold down the up and the down button. I can go next to flow. It's on 30 liters per minute right now, and they're color coded. Temperature is orange, flow is blue, oxygen is green. Kind of makes sense to me. How far does the flow go on this one? How high up did I tell you?
60.
60. So I can go all the way from, I think, 10 to 60. So put in your desired flow. How do we know what flow to put the patient on?
From the order.
Yeah, from the order. And then I lock in my choice. We have a flow meter on here. How do you think we set the oxygen? Do you think it's with the button, or do you think it's with the flow meter? It's gonna be with the flow meter. So there's an oxygen sensor in the machine. You dial the flow with the flow meter. The flow meter numbers on here really don't correspond to the FiO2. They go 10, 20, 30, 40, 50, 60, 70 on this one. I have it at about a 25, and it's giving me 92% FiO2. It will change a little bit from check to check. You might find it at 89 one time and 91 the next time if you want it on 90. So you just kind of reset that to what you need it to be, and it will show on the screen, okay? And am I missing anything, Professor Kleiman, with that?
I don't think so. Just sterile inhalation, sterile water.
Yep. So we have our interface. There is a clip on here. If you pinch it, it's kind of like scissors. You can use that to attach to the patient's gown or whatever they have on. This is kind of heavy, it's cumbersome, and you don't want all the pressure of all of this to be on your face. Okay, you want to give it a point to hold the circuit. It also goes with them if they are rolling over or doing stuff. It's less likely to get pinned. The interface for this specific equipment is going to be this kind of cannula. So it's called nasal prongs. There are different sizes. When you size nasal prongs, manufacturer recommends, and recommendation is, the prongs should not be more than 50% of the size of their nair. As they get bigger, the prongs get further apart too. So you make your best judgment with choosing your size. I usually bring a couple in with me. In this case, in this one, the prongs go in just like a nasal cannula does. So like, I always say like curves towards the toes. So when you put it in, the curves go toward the toes. And in this specific one, I'm not putting it in my nose, friends, but it goes around the head. So it will go over the ears, prongs in the nairs, in that way. So where do you think we have to monitor skin assessment, specifically with this one?
The cheek, like around the cheek.
Yeah, from the nairs to the cheeks, especially over the ears. This isn't even soft plastic, it's like stretchy fabric. So you want to be looking at nairs, cheeks, ears, maybe even back of the head. If your friend does not have hair, this piece of plastic can lay against that if they're not moving much. Does that make sense? Mm-hmm. Okay. We also have heated humidity on this, right? This heater is on. We have it set for 37 degrees, and it connects to a bag of sterile water for inhalation. Don't ever grab a bag other than sterile water for inhalation. There's lots of bags of water if you go into clean holding, am I right? But ours are sterile water for inhalation. High flow runs through these bags very quickly. Back pre-COVID days, when we only had the 1 liter bags most of the time, you were changing bags extremely frequently on high flow. 2 liter at least will give you maybe like a quarter of your shift, a third of your shift, a half your shift, depending on what they're on. But there should always be water in the bag. It can damage everything, and it will cause the temperature to go up if there isn't water in the chamber. So every time you're checking your patient, you're doing all of your normal checks. What are we checking again? What are we assessing for our patient?
Vitals.
Vitals.
Accessory muscle use.
Accessory muscle use.
Skin color.
Skin color.
Breath sounds.
Breath sounds. Subjective feeling. Clutch with the subjective
like
feeling.
facial sores.
Yeah, if they have any facial trauma, are we strapping a piece of equipment to them if they have facial trauma?
Diaphoresis.
Diaphoresis, do they look like, are they sweating? Do they look like they're in distress? Chest rise.
Clubbing.
Yeah, clubbing.
Level
We're
of
doing
consciousness.
level of consciousness.
Pitting edema.
Any edema. We're gonna monitor all of those things, especially skin-related assessment, vital signs, breath sounds, all of it. We're gonna do our skin-related device check, and when we're checking the flow, the FiO2, the temperature. We're gonna monitor the level of water in the bag. We're gonna change it if we need to. If you're weeding high flow, like you're trying to wean it to get the patient off of high flow, you're making small changes per order or per protocol where you're working. And I think I covered everything.
No alarms. Built-in alarms.
Oh, built-in alarms. This has built-in alarms, you don't set them. So if it's alarming, and 9 times out of 10, it's gonna be an interruption in flow from here, or an interruption in flow from here, or the cannula is, you will find these all over people's faces. They will be everywhere. If the cannula is over here and like not in an air, it's gonna start alarming. This machine loves to alarm. So you're gonna hit your alarm silence button, and you're gonna figure out what's going on, start at your patient, work your way back to the equipment. That is always going to be the advice with any piece of equipment we teach you about. Start at your patient, work your way back to the equipment.